Please, okay? When you go to a conference, take a note. Okay? If nobody ever asked you to do so. Okay? Everybody, I might not even give you my notes. You don't have a right to my notes, my presentation. I'm coming here to teach you. It's not easy to spoon feed you. Okay? So me, I'm different. The way we never had the books when I was going to class. Okay? We did not have a slide. The teacher wrote on the blackboard. Okay? So I wanted you to kind of a little bit, when you go learn a lot when you write. And you go back and review the notes. Also, another thing I wanted you to put your leadership class. When we were in high school, we never learned how to use a spoon, fork, and knife. Okay? When I was growing up, we used hands. So when we went to school, was a Catholic school.
Where?
We had the team leader sitting on both sides. Okay? So the things I'm telling you, we're not going to see the presentation. You take the notes, you learn as you go. Because those are notes you go keep them. Sometimes when you are in leadership, you might go back to your notes. Okay? Somebody told you the story, and you can just write it to remember it. So that's the best way you learn. Whenever I go to a class, whenever I go to a meeting, I'm taking notes. Okay? So the definition for entrepreneurship, that one you can go in Google it. There are many ways people are going to explain entrepreneurship. For the class, I just chose the one according to the Howard Stevenson. Entrepreneurship is often taught as starting a new business, creating innovation. But in reality, entrepreneurship, in my view, is to pursue something beyond the resources you have in control. So when you start a business, if it's something you think about, then you say, okay, I really want to solve the problem. Somebody said, I want to promote health in the community. And you can go create some business and make a living because you became innovative to create something nobody else has done. Okay? Like in the US, we have what they call, we have ambulances. Okay? And the ambulances are run by paramedics. The paramedics, they are not nurses. Okay? They learn how to do the basic life support. Okay? So then somebody in our community created a business to support the community, to run ambulances. They own their own ambulances. So then when they call, so they're going to charge you to transport you from point A to point B. Okay? That's somebody who created an idea to do a business in the healthcare. So now you can train the people because you already know how to do basic life support. That's another idea. That person created attitude to support, even though they went in healthcare, but then they find something that they can do to make it their own job. So that's the innovation. Okay? those are the examples. So somebody asked me, okay, what kind of business I did. So in the US, we have, like in the city, we will have at least 10 hospitals in the city. This big city. We will have at least 10 medical centers. Okay? And each hospital will have maybe 500 nurses. Hello? Mugende kuganira ahandi. Kuganira ahandi. So imagine we have 10 hospitals in the city, which eventually is going to happen in Rwanda, in Kigali, when you guys become smart and become independent. So you have 10 hospitals, and you have 500 nurses in each hospital. How many nurses are there?
500. 5,000.
5,000 nurses. Okay, so in likely, they are going to have what they call a vacancy. Hari abantu bazajya bava mu kazi bajya mu kandi kubera ko hari komisiyo. Nubwo ntabwo turagira komisiyo niyo mpamvu. Niba noneho ibaze ujya hano sesika bakamara iminota 20 batarakwakira muri iri janse, uzi ko wajya hano hepfo mu minota 5 ukaba ubonye umufasha. Sesika icyo gihe izabura abakiriya. Noneho bya bitaro bimwe bikora neza bizabona abakiriya. Nibagira abakiriya benshi niko bazagira financial income. Niho bazagira abakozi benshi. Okay? No, ntabwo ari ugukora byonyine bye. So customer service has to be part of it. That innovation, you have to create the customer service. So the customer service is going to make a difference when your people work. So if I know you're going to be a manager, and you don't treat your nurses nice, you treat them like you guys, when you start making money, you go hire people work for you in your house. And some of the nurses, they think the nursing staff, they can treat them like the workers who never went to school. Bakabakoresha nk'aho ari abakozi bo mu rugo. Icyo gihe rero ntabwo ugira rentability. Ya innovation niyo utazagira business yawe, be creative, be innovative, do something other people don't do. So then I'm going to cover 10 steps of entrepreneurship. One is realize your dream. I want you to write down for me. You don't need to share, but what's your dream? What's driving you? What's your dream? Okay? Maybe you never asked this question. So beginning each year, from now on, you guys still single. Arabari barongora. Okay. So each year you meet with your family in January, and you write the dreams you want to accomplish for that year, and they put in writing though. Okay. So write something that's driving you. Why do you get up every morning? Okay. That's the dream. That's the driving. Okay. Then the second step develop a supply-based system. So if you're going to start a business, you're going to start thinking, okay, where am I going to get the supplier? Who's going to support me? Then number three, you're going to open a business account as for the business. And then number four, you're going to have a plan. And number five, you need to be organized. And then number six, you develop a supply chain. And number seven, you start marketing your business. And number eight, you develop something different than anybody else. Number nine, you do consult your for the people who done it, who are doing better, who are succeeding. You don't go ask counseling for somebody who has not succeeded. And number 10, as a business person, you get up area, you go sleep late. Okay? So you do whatever it takes. Okay? I'm going to go to each everyone in details. So I'm going to appreciate more. So when I say what's your dream? What is your dream? So what is, in other way, what's your desire? Okay. So really you have to have an idea, and to think the idea is going to flourish. So the problem if you go ask your brother who has not gone to school, I have this idea about the business. Do you think it's a good idea? Most of the people who are your family, they're going to say, you crazy. Okay? They're not going to really encourage you sometimes. So don't be afraid because your family says that, no, that's not a good idea. Because they are not thinking in those terms. I will go look for somebody who has that business and find how they were able to do it. Then you're going to get better. Also, they're not going to be afraid. Also, they're going to tell you the challenges, the reward, and so then the person who's not a business person, when you talk about you're going to get up in the morning, imagine even the people who have a taxi, you know how early they get up to get the passengers. So they have to get up, they have to clean the car, they have to, all those things. But the reward is having enough money to take care of whatever their family, which they will not have done if they did not do those work. So you have to kind of know that entrepreneurship is not just, it's not really easy work. It's a lot of work, but it gives you freedom. Are you tired of waking up day after day to go and work for someone else? Some of us, we don't like to work for other people. We want to be our own boss. Okay? So when you start a business, you are your own boss. You make a decision. I want to this. So you are the one who's going making the decision instead of somebody else you're working for. So imagine your household, a unit. So you, the ones who have fathers or mothers, you make a decision for that family unit. Nobody else comes to tell you what to do in your family. So when you do a business, it's the same way. So you are in control, you make the rules, and you bite by those rules you made. So if you make good rules, you're going to be a good boss. If you make a bad rules, you are the one who's going. There is nobody else is telling you. You are the one in charge of that. So, so now is the time when the opportunity presents itself. Means maybe maybe we're going to talk about it later, but so you start listing examples. One thing I find in Rwanda, why the business don't succeed, when somebody opens the shop, they see that business is working well, everybody else start doing it. Okay? Doesn't work. Okay? So I can predict what I'm seeing in Kigali. There are people building many hotels, building big houses, and they don't look at the client. They think the foreign who are coming in the city are the ones who can rent the houses. They go in the bank, they get the money, they build a big house, they can afford to pay. So then what's going to happen? So we just experienced that one in 2008 in the US, where we built so many houses, more than the supplier, more than the customers willing to pay. So then we did the market fall. So that's what I'm seeing in Kigali. So if you have another business idea, to think, okay, I'm going to build a hotel. Then that's not the best idea in the city. Okay? So we are building all these hotels, but the problem is not to build the hotel, it's to build it beyond the market. Okay? So let me give you an idea. Okay, if you go build a house, apartment complex, but the target for the nurses' income. Okay? So the nurses make maybe 200,000. Okay? Those people want a house, has running water, has a good road, has electricity, has technology. So build a house where the nurses will be able to afford to pay a month, maybe 100,000, 80,000. Then your market is not going to end. And so going to build for me, who are small percentage of 1% in the country, and I can finish my portion and go back. So then it's why the business here, like in the Kyoto, everybody's building all these houses and the buildings, but they're not going to have a client. And you can't tell them, you know, if I was here in the States, how they will do the market, they will come in the hospital, see how much income nurses make. Those nurses, I want to capture their market. Okay? Then I will build the houses to house those people. They don't have to go in the countryside where there's no water, there is no electricity, no technology. I want to where there's internet, I want to be able to go out. Then you start building in the shopping mall. You start, like here, the market they are doing, just for the little kids, like for 5% market. So then they forget that 95%, that's where the money is. If you're going to do a clinic, okay, take care of those primary care, those prevention, where the patients will come to you. So, to do counseling, to do teaching how to eat, to do those kind of things. You're going to get a big market. And it's not as difficult, it's not as expensive as to build a hospital. You see where the market, you guys, if you guys taking notes, that's where your market is if you want to do business. I'm assuming 10% of you guys taking notes and going to do this. You know, 90% are not going to do it. Okay. So if you are among those 10%, I'm talking to you. Those are the ideas you need to do. Let me go back to that 10 hospital in the city. What I saw, the market, I saw that you can. I was making good income as a but I wanted to do more. I want to be able to support more people, both in one. I want to have freedom to come and I had to worry about my job. So in 2003, I started a program to hire temporary employees. Temporary employees. Somebody, I don't want a full-time employee. I want a people who just, I can hire them for 3 months. Okay? So I can hire 3 months and they go to the hospital. They have shortage staff. So when somebody employee leaves, there is vacancy. Kugira ngo bazazane undi mukozi bizatwara amezi nk'atatu. Ariko abakiriya abarwayi barahari bakeneye abaforomo. Imagine rero noneho nimara kugira competition hano mu gihugu bagenda abakozi babatwara hirya no hino. Ndaje uri mu bitaro uri CEO ndababwira rero ngiye mfite abakozi bafite experience, bafite certificate, bafite emergency, bafite specialty yose ushaka. Abo bakozi ndabagushakira. None ariko kugira ngo mbaguhe yewe ngomba kugushakira amafaranga menshi. Kuko abaforomo nanjye nzajya mbahanga amafaranga arenze ayo mu bahemba. Niba nahembaga ibihumbi 200 mu bitaro, yewe ndabasha ibihumbi 400. Urumva? None umuforomo mu ibihumbi 300. Urumva? Urumva icyo ndi nkozi? Ariko nta benefits nzaguha uzirware. Urumva? Uzagenda wishakira assurance, uzayikora, uzapaya tax zawe, yewe nzaguha ibihumbi 300 wirware. Nawe ugomba kuba uri umuntu entrepreneur. Kuko wemera gukora izo risk. Urumva? Yewe rero organization yanjye nzajya mbona ibihumbi 100 byo gusuporta business yanjye no guhemba no kumpemba no guhemba abakozi nzakoresha. Urumva? Ibaze noneho mfite abakozi 10. Okay? Yewe noneho ibyo bita duplication. Urumva? Ntabwo ugenda ashobora gukora amasaha niba mfite abaforomo 10. Ubwo niba bakoze amasaha 40 mu cyumweru, wese amasaha 400. Okay? Yewe rero nari umwe none ni military. Ni kukoze business. Noneho ndagiye abafata small profit margin. Ariko noneho wa muforomo nawe azishima kubera yuko hano mu bitaro bamuha ibihumbi 200. None ugiye ndamuha ibihumbi 300 azaza kunkorera. Urumva? Noneho competition rero itangira. Noneho ndafata abaforomo bakora neza. B'abahanga bafite experience. Noneho muri business plan njye muri banki niba ashaka amafaranga gutangira kugira ngo njye gukora payroll. Kuko igihe bitaro bishobora kumpemba gatinda. Yomba no gukorana na banki n'ibyo twavuga ngo ugomba kugura konti. Gatangira gukorana na banki kugira ngo nize amafaranga igihe bitaro bitarangishira mbe nishyuye abakozi banjye. Buri gihe abakozi banjye baba bahemberwa gusa. Nta kuvuga ngo nakererewe. Muri kazi niho duhemba buri cyumweru cyangwa buri cyumweru. Niba urangije amasaha 40 ndaguhemba. Ntabwo dutegereza ukwezi. Utegereje ukwezi ntabwo wazabona abakozi ntabwo wazajya. Kandi nta bintu byo kuvuga ngo wakererewe guhemba abakozi. Niba uri umukoresha itariki wemeza ukavuga ati ni 15 ugomba kuza abakozi. Mbese iryo jambo ryawe niba uri umucuruzi, your word, it's your word. Okay? Nta byaha byo kuvuga ngo ahubwo ugende emera no kutarya ariko abakozi banjye bahembwe. Mbese iyi ngiyi ikaba irabisize waba n'uzaba shefu mu bitaro, abampuwaye bawe ntibahembe abakozi, mukagenda mukavugana na CEO. Ibyo ntabwo ari byo. Ngomba kuriha imyenda kuri 30, ntabwo wandiha kuri 5. Hanyuma se banki ndayibwira ngo ikiye muri ngomba kwishyura umwenda 30.
Nabazaga ko mwavuze ngo ni short time cyangwa se igihe cy'amezi nk'atatu, ubwo uwo mukozi wagira kontra y'amezi 3 bikabirarangiye. Iyo none se iyo mu bitaro
bakimukeneye ushobora gukomeza, ariko mbese ngese ubundi ushobora ugenda unuvera kontra uko bayikeneye. Hari nkaho nigeze gukora umwaka mu bitaro bimwe, ndio mu temporary employee. Nakoze organization yo gukora medical mission nyiza hanze n'ikipana y'abantu. Kubera gukora ibyo ngibyo nashoboraga kureka akazi haza amara ibyumweru 2 ntakora kongera agasubira.
Hano mu Rwanda
hazana abantu ba volontaire ntabwo twahembaga, ariko kubera yuko ufite facility y'amafaranga wakreye bikaguha uburenganzira ubushobozi bwo kuza gufasha abandi benshi. Niba uri umu businessman ntabwo uri uvuga ngo ni wowe wikirira wenyine, ahubwo nawe ugomba gufasha abandi. Niba ubonye amafaranga menshi ntabwo ari ngo amafaranga ntayo tuzajyana. Ni ukumenya impamvu ukora ibintu, ugafasha famiye, ugafasha abaturanyi, ugafasha. None iyo umaze kumenya yuko wakize ni ugufasha umuntu utanazi. Cyane mu Banyarwanda rero nicyo kintu gikomeye, kugira ngo witange uvuge uti nk'ubu mfite abana ndira mu ishuri nk'abatanu mu Rwanda, abo bantu nta n'umwe ufitanye amaraso yanjye nanjye. Iyo umaze kugera aho ugera kuri nivo famiye yawe, ntabwo ari ngombwa ngo ufashe famiye gusa, noneho ukajya hanze, kuko bifashe wa muntu nawe bazafasha abandi. Abo batanu nafashije ibibazo buri muntu nibafasha babiri, abantu benshi uzaba duhindeye za famiye yawe. So niba ukize wewe gukira wenyine, the development prior
kandi kabazo tukiri aho ngaho mwavugaga mu bitaro yuko mushobora kugenda mukadiringa n'umuyobozi w'ibitaro mukavuga ngo mbafitiye abanasi bari competent. Ese we aho kugira ngo ajye gufata umuntu wamuzaniye amuhemba ibyo 400 kandi abundi ibitaro bihemba 200,000 n'urugero twafashe, kuki atashakisha we ku giti cye abazahemba ya magana
azabashaka. Ariko igikomeye ni iki? Uzi ko umukozi umwangaje ugomba kumukorera orientation. Uzi yuko yenda mbona hano mwebwe mutabikira severite, ariko umukozi niba uje muri iyo ntabwo uzahita ukora aramarishe nk'uko wa mukozi yakora. Yewe tuvuge nakoraga muri etansitikezi, hari ibyo hano mudakora byitwa open heart recovery. Mbese iyo umurwayi nziza mwari mwajya hariya kuri King Faisal bakoze y'umutima.
I was there one day. I was in the theater.
Yeah, had to surgery. Murumva rero kugira ngo ugire mu critical care nurse mbajyana haye nk'imyaka 5 kugira ngo mbe ngire kuri iyo nivo. noneho kugira ngo umbuze umukozi umwe hano nari mfite tuvuge uburiri butanu, abarwayi batanu baza buri munsi gukorerwa shije y'umutima, mfite abaforomo batanu, none umwe aragiye, umwe niba agiye ubwo nzaperida uburiri, nzaba peride, nzajya mbona abarwayi 4 ku munsi, umushije ntabwo azazana abarwayi afite umuforomo ugomba kubavura. Urumva kwasi bihari. Noneho kugira ngo nzaperida amafaranga y'umushije udakoresha bwa buriri bwose bwo muri Isanzure, kandi iwacu tuvuge Isanzure uburiri umwe utavuze ibindi ni amadolari 1000 ku munsi. Ni amadolari 1000 ku munsi. Uburiri muri Isanzure nibyo bazagushaka. Rero niba pereze iminsi 5 urumva amafaranga umuntu abaho
5,000.
urumva umbese uri mu karikira ibintu bya rose. Noneho rero niba agiye muri Isanzure kugira ngo abarwayi banjye bakomeze baze, nuko ngomba kugira abaforomo. Uwo muforomo rero nubwo ukeka ko ari share, ntabwo ari share, uburikize profit nzamukuraho. Niyo mpamvu rero ugira iyo niche, umaze kumenyera bitari uko business ikora. Jewe natanga amafaranga y'training undi muforomo uzaramfura abandi wagiye, noneho wa undi temporaire yamara uriya nabona amaze kumenyera akazi, noneho kontra yawe nkayirangiza. Ariko noneho haba hari n'undi bindi bitaro nabyo birimo muri iyo episode imeze nk'iyi.
Noneho icyo ukora no kujya gusakira vacancy
mfite zahita nk'eshanu. Mbese muri Isanzure ibaze mu Rwanda hari leta 50. Mu Rwanda rungana n'imwe leta yitwa Maryland. Mbese niyo ntoya muri Isanzure ingana n'u Rwanda. None ibaze rero ufite teritori 50 zingana n'u Rwanda tuvuge. Urumva market mbese yawe ufite. Mbese ibyo perezida buriya bakorera ashaka ko dukora yise union. Ibaze mbese no ufite business hano y'umusoro yo staffing. None ugiye muri Kenya, ugiye mu Buganda, ugiye muri Tanzania, ufite iyi service. Gusubira ukuntu mbese market yawe ntabwo uzagira wisatisfied. Buriya mbese nicyo baba bashaka kubakorera muri business sense, ni ukugira ngo open market. Niba bafite ibijumba nagaburiraga abantu 50, noneho mbonye
50,000.
Icyo gihe rero umuhinzi uhinga ibijumba azahinga byinshi kuko azaba afite abantu babishaka. Mbese nicyo mbese ubu ngubu economy barimo bashaka kugira ngo berimine za border. Ibaze kugenda mu gihugu zahita 50, wagenda amasaha icyumweru cyose nta muntu urakwaka urupapuro rwa passport cyangwa visa cyangwa iki. Urumva ukagenda icyumweru mu modoka wiruka reri 100. Urumva nta muntu uraguhagarika ukiri mu gihugu kimwe. Niko cyatugeze. Niba uri umuforomo muri leta imwe ugeze kumbaza, izo 50 zose zikora ufite ikibazo cyo kuzikora atake registered nurse. So registered nurse, you never lack of work. Kandi babandi bakoreshaga hari n'abanyamahanga benshi cyane. Ahubwo abanyarwanda nuko mutaragira niveau ya education ngo mwige nk'uko Abamerika biga. Aho muri Philippines biga niveau yo muri Etazi, bakiga registered nurse ku buryo bakora ikizamini national bakagitsinda. Mbese twebwe niveau yenda barimo babapushinga, twebwe twaje hano niyo turimo tubenfluence zuriya za module barimo baintroduce hano, niko twebwe twiga. Ukarangiza uri umuforomo, none ukakora cya kizami cyitwa NCLEX, aricyo kizami cyerekana yuko uri competent. Icyo gihe noneho ukajya muri marketplace ukagenda icyo kizamini gitsinze nicyo kiguha permission yo gukora muri sitasiyo.
iyo ushaka kujya muri Amerika rero ugomba gushaka ikizamini cy'icyongereza. Icyo kizamini nacyo ushatse cyose nayo ushatse wayishyura.